We are going to go ahead and get started. If you do encounter any difficulties as we're going through the presentation, you can definitely type it in the chat area and we can address it. But to kick things off today, my name is Erin Gabriel. I'm the admissions coordinator for the DPT program, and I'm joined with Dr. Kevin Gard, program director and vice chair of the department here at Drexel University. We're just going to spend about the next 30 minutes or so going through a little bit about the program, some of the features and the curriculum and admissions components, and we're going to leave questions and answers till the end. But as we're going through the presentation, if anything comes to mind that you want to ask, we are going to address all the questions through the chat feature. So at any time, feel free to type your questions, and again, we will address each of them at the end of the presentation. So with that being said, I'm going to go ahead and turn it over at this time.
So good afternoon, everyone. As Erin said, my name is Kevin Gard. I'm the director of the DPT program. And I always find it somewhat helpful in presentations like this for you guys to have. Once we get our technical, there we go.
There we go.
That you guys have a visual representation of the two of us, and you can connect a voice with a face. So obviously I'm the one on the left, and Erin is the one on the right. What we hope to do, like Erin said, is to just give you an overview of some of the special features about the Doctor of Physical Therapy program at Drexel. I don't like to spend a ton of time on information that you guys can get off the web or from other sources. I'd really like to spend more time discussing some of the things that may make us different than other physical therapy programs that you might be looking at, so that you can make an educated decision about which program may be most suitable for you as you progress towards a career in physical therapy. So just to give you a quick overview of just a couple of features relative to Drexel itself, just to give you a flavor of the university itself. Drexel is known as an experiential learning institution. And what I mean by that is at the core of Drexel's education system is what we refer to as cooperative education, which essentially means that almost all undergraduates at Drexel spend a portion of their education, for some students it's up to a year and a half, out working in the field of their interest. So for engineering students, they'll spend a year and a half of their education working in engineering. And the reason I bring that up is because what you're going to see as we go through the physical therapy curriculum, that our curriculum mimics that quite closely, in that you'll spend a fair amount of your educational time actually in clinical settings, either part-time or full-time, practicing the skills that you are learning in the classroom. And as we'll point out to you, it's during those times where you really learn to hone your skills and you improve your skills so that by the time you graduate from the program, you're ready to begin a career in physical therapy. The university campus is right downtown in Philadelphia itself, so it's part of the city. The city itself is a very lively environment filled with restaurants, theaters, sports, parks, great places to run or bike. It's a really, really fun place to live. Drexel overall is ranked in the top 100 of universities, and it's really kind of hangs its hat on being an innovative university in almost everything that it does. In terms of just overall enrollment, Drexel has about 25,000 students who are on campus. About 16,000 of those are undergraduate. A little over 9,000 of those are graduate students, which you guys would be part of that graduate student body. In terms of our department, so the Department of Physical Therapy and Rehab Sciences, there's just a couple special things that I'd like to point out to you. We obviously offer educational degrees, but we offer educational degrees at a couple different levels. The Doctor of Physical Therapy program, which you guys are interested in, obviously trains people for an entry-level position into physical therapy. but we also train all people who are already physical therapists who want to advance their career. So we have an orthopedic residency where already licensed physical therapists come and practice with us and get advanced mentoring in treatment skills to try and improve their overall ability to treat patients. We also have a PhD program where we train scientists who want to do research in some field associated with rehabilitation. In addition to our education programs, I think something that makes us very different than other education programs and other physical therapy programs is we actually operate 3 clinical practices out of our department that are mostly staffed by faculty in our program. So we have a clinical practice on our Center City campus and on our University City campus. And then we also operate a pro bono clinic a little north of here in a housing community where we provide physical therapy services to the residents of that community. And the reason I sort of think this is a special, unique feature of our program is that our students who enroll in our program in the first week of the curriculum, they may be in our clinical practices working on honing those skills that I talked about before. And they're doing it side by side with a faculty member that they could have had in class that day. So what this really, I think, helps provide is a rich environment to learn the things that you need to learn to become a physical therapist and to really reinforce the things that you're learning in the classroom itself. In addition, our department does a fair amount of research. We have a research lab that's actually integrated with our clinical practice on the Center City campus. On the screen there, you can see a few of the areas that we do research in, including gait and biomechanics, issues related to osteoporosis and balance and falls, so things related to low back pain, and some stuff related to ACL injuries too. And there's some opportunities in our curriculum where you can get involved in some of those research opportunities. In terms of our overall mission for the DPT program itself, and I bring this up and want to present this to you because this is overall what our objective is relative to the DPT program. This is what all of our faculty and staff strive towards with all of our students when they enter our program. So we hope by the end of the program that we've prepared competent, compassionate doctors of physical therapy by promoting excellence, evidence-based practice, and lifelong learning. And we hope to graduate innovative practitioners who exhibit civic and professional responsibility in diverse healthcare and community environments. Now, obviously, that's a lot of words. What I'd like to do is sort of pick out the underlying words in this here and expand upon those a little bit. So the first of these is excellence. Our hope is that by the time our students graduate from our physical therapy program, they are excellent practitioners in physical therapy. And we want them to be excellent practitioners in physical therapy in a variety of different places or in different areas. So students who graduate from our program get knowledge and skills, learn skills in a variety of different areas. So this could include physical therapy that might be provided in an acute care environment, might be an inpatient rehab, might be in outpatient settings, might be in a nursing home, might be in-home physical therapy, might be outpatient orthopedic practice or an outpatient neuro practice. Throughout the course of the curriculum, you will touch on all of those areas. And beyond that, you also touch on different patient populations. So you'll have coursework on physical therapy that deals with pediatric populations as well as geriatric populations and all the different ages in between. So our hope, again, is by the time that you graduate that you have knowledge in all of those areas and could work as a physical therapist in any one of those areas. What really goes along with, what really goes along with being an excellent physical therapist is this whole notion of practicing based upon evidence-based practice. Really what I mean by that and what we try and emphasize to our students is that there should be some evidence behind any evaluation or intervention thing that you do with patients. So we really try and push our students to be familiar with the literature, to be comfortable going to the literature and looking for answers, so that when they are in front of patients or trying to make treatment decisions, they have a good idea of what the research says about a particular condition or a particular type of intervention, so that they can provide the best care overall possible for that patient. We also try and make our students lifelong learners. That is very important because, as you probably know, in the healthcare field, things change. There's new research that comes out that really changes the way that we might treat a particular condition. So the only way that our graduates really maintain their status as that excellent practitioner that they were when they graduated is if they are lifelong learners who are willing to read the physical therapy journal or other journals that are available to stay up to date with current literature. They're willing to go to continuing education courses, that they're willing to talk to other healthcare professionals. So they're constantly striving to improve their skills. The next word that I sort of want to pull out of our mission is this whole notion of being innovative. Again, because Drexel's known as this innovative university who looks for unique solutions to problems, we try and instill that in our students as well. We want them to look at problems differently and try and come up with creative, innovative answers to those problems that maybe no one has thought of before. And the last piece of this is we want to try and instill in our students this idea of civic and professional responsibility. This idea that, you know, you're going to enter the profession of physical therapy and you're going to go out and treat patients, but your professional career really should be more than just treating patients in and out every day. It should be more about, or certainly a component of it should be about serving the community around you and providing services to those less fortunate than you. And I think we really demonstrate this with our pro bono clinic that we run. As I mentioned before, we provide physical therapy services to a very poor and underserved community. And all of you who enter our program get the chance to be able to go provide treatments in those settings. And you know, part of our purpose of running that clinic is to try and model that behavior that ultimately we want to see from the graduates of our program. In terms of our faculty, we have 18 core faculty members. All of those faculty members are involved in one way or another with our DPT program. So you'll see all of these faculty members at some point through the curriculum. You know, I'm frequently asked by students, by parents, by people who are interested in our program about what makes our faculty overall so special, or what is it about our program that is so special. And the answer that I always have with that is that our faculty are really invested in our students being successful and ultimately becoming that excellent practitioner that I talked about. So when students enter our program, when they decide to come to Drexel, in my opinion and our faculty's opinion, we've established a contract with you that essentially says that, you know, we're going to try and provide the best possible education to you. We're going to work really hard to make you the best physical therapist we can, and in return, you're going to do the same. And in the end, you know, after the little under 3 years of our program, you know, you'll graduate your physical therapy degree and enter the profession operating at a very, very high level. I think the other thing that really makes our faculty special is that almost half of them are still heavily involved in clinical practice. And that may be involved in our clinical practices or involved in practices in the area. And I think that's important in a clinical degree like the Doctor of Physical Therapy program, because in your clinical courses, it's important to have someone who's lecturing to you, teaching you skills in the lab, who does these things day in and day out, who can speak to, you know, current problems that they're seeing clinically, so that, you know, they can educate you in the best way possible. On the flip side of that, the faculty that aren't as clinically active are more research active, and that is equally as important because, as I mentioned before too, we try and instill in our students this whole idea of evidence-based practice. The only way you can really be a good evidence-based practitioner is if you are comfortable going to the literature and reading that material, and you're able to digest it and figure out how you're going to implement that in your practice. So just like with our clinical courses, it's important to have someone who's active clinically teaching those. In the research courses that we provide to you, it's important to have someone who's standing up in front of the room who's active in research. And so many of our faculty members who have a more research focus to them teach those research courses in our curriculum. So as I mentioned before, we have great educators who are invested in student success, and then their backgrounds in terms of clinical and research. In terms of the curriculum itself, we are CAPTE accredited. CAPTE is the organization that accredits all physical therapy programs. We are accredited till 2024. Our last visit was in 2014, and at that time we got the longest period of accreditation that CAPTE will grant you. In our curriculum, there's 128 quarter credits that span 11 quarters, and I'll spend a little bit of time here in a second discussing the quarter system. And as I mentioned before, you complete the program in a little less than 3 years. So our students start the program about the 3rd week in September, and they'll go full-time year-round and end up finishing the program at the end of what we call our spring quarter, which ends about in June. So as I mentioned before, Drexel's on the quarter system. So our quarters mimic the seasons of the year. So we have fall quarter, winter quarter, spring quarter, and summer quarter. Each quarter is 11 weeks in length. So 10 weeks of that is instruction, and then the last week is finals week. The quarter system in general works really well for us because as I mentioned before, much of your education will involve being in clinical environments, practicing those skills that you're learning in the classroom. And our 10-week quarters really allow us to put you in the classroom for about 10 weeks, and then you'll see when we send you out on full-time clinical rotations, you're out on those for about 10 or 11 weeks. So it really makes it really breaks the year up the way that we want to in terms of the didactic classwork that we give you, as well as the clinical classwork. For most students who come into our program, they're not as familiar with the quarter system as they are with the semester system. For most of those students, what they find is that the quarter system tends to move a little bit faster than what the semester system does. That doesn't mean, however, that we pack a semester's worth of information into a quarter. I know that to be a fact because at one time we were actually on semesters a number of years ago. When we changed over to the quarter system, many of the courses that we taught in one semester are now 2 quarter courses, okay? But that being said, it does feel like it moves a little bit faster. A lot of students like it because you change courses more quickly than you do in the semester system. So you're changing courses again every 11 weeks as opposed to 16 or 17 in the semester system. We have what's called an integrated clinical education model, which essentially means that we mix your clinical education experiences in with your didactic classwork. And that's done in 2 ways. We have what we refer to as our ICE experiences, which ICE just stands for Integrated Clinical Experience. So those are part-time experiences that, as I mentioned before, you will start doing in the first week that you are here, and you do those in each of the first 4 quarters that you are here in our program. Then following those ICE experiences is when you start your full-time clinical experiences. And those full-time clinical experiences are broken up into 3 separate experiences that total somewhere between 32 and 33 weeks. Those experiences are done in facilities across the country, or we even have some students who rotate to a facility that we affiliate with in Italy, so there are some chances to be able to go abroad. In addition to our clinical education being integrated, we also try and integrate a lot of our coursework across the curriculum. What I mean by that is many of the courses that you'll take, although they're separate standalone courses, many of them try and integrate or try and make sure that they're covering similar topics or similar body regions at the same time. So for example, in your first 2 quarters here, you take a gross anatomy course, a kinesiology course, and a physical therapy examination and intervention course. Again, those are 3 standalone courses, but the courses are highly integrated with one another so that as you're dissecting the shoulder region, in kinesiology, you're talking about the shoulder, and in PT exam and intervention, you're also talking about evaluating the shoulder as well as talking about interventions that you might provide for particular conditions. We find that that integration amongst the coursework really helps reinforce concepts and really helps students learn the things that we want them to learn. And as I mentioned before, the curriculum itself is going to touch on all areas of PT practice in a variety of settings with a variety of different patient populations. A couple other unique things that I just wanted to point out about our program is we have what's referred to as a simulated patient lab, which is essentially, it looks much like a doctor's office would look or a physical therapy office would look. And what we do is we hire actors who come in to act out various patient scenarios that we want them to act out or we want to expose our students to. And the students go into these rooms and they try and perform the skills or do the evaluation things that we want them to do. And while they're doing this, they're being videotaped and audio taped so that we can look at those later, the student can look at them later and learn from them, okay? So these start, in fact, the first quarter that you're here, you're put in the lab itself, where you learn to take a patient history, and you can see yourself take a patient history. And then you do 2 other of these simulated experiences later in the curriculum, where you might be taking a patient history and examining the patient. And then the last one is where you might be doing the whole thing, taking a patient history, doing an examination, and then ultimately coming up with interventions for the patient themselves. Again, what we really see these as is these are great opportunities for you to see yourself in that particular setting and to get feedback about how you perform those skills. Faculty will look at these and sit down with you and give you constructive criticism on them. And ultimately what we use these for is to make sure that students are ready to go out into the full-time clinical environment and operate as a student physical therapist. So again, this is like one of the advantages I think of us having our own clinical practices. If we find a student maybe struggling with particular skills and those struggles really come out in these simulated experiences, oftentimes what we can do is have them come spend time with us in our clinics while we're seeing patients so they can work on those skills so that hopefully by the time they get to their full-time clinical experience, that isn't an issue. There's also a couple other technology things that we use in our curriculum. We have simulation mannequins that we use. These are mostly used for our cardiopulmonary coursework. So these mannequins can simulate things like increases in heart rate or drop in heart rate, drop in blood pressure or high blood pressure, those types of things that we can't simulate with other students or models or that sort of thing in our labs. We take almost all of our exams and quizzes online at this point in our curriculum, and this is done because the licensure exam that you take at the end of the curriculum before you can become a licensed physical therapy is administered online as well. It's a computerized exam. We want our students to be used to taking the exam on that medium so that doesn't become a barrier to performing well on the exam. And then the last piece that I'll sort of point out here technology-wise is that we have an electronic health record that we use in all of our clinical practices. So as you rotate through our clinical practices, you're going to get exposure to documentation in an electronic health record. Sort of another unique feature about our program is we do offer an optional service trip that's offered between your second and third year. For the last, I think this is our 8th year this year, that we'll be taking a group of students, some faculty and alumni to Guatemala to provide physical therapy services there. We spend about 8 to 10 days provide services in a rehab center down there, in patients' homes, in community centers. Again, I mentioned before, this is optional. Our students fundraise for this, and we normally get about 12 to 15 students out of the class that want to go, and it's a great opportunity, if you are able to go, to just see healthcare in a different country. And again, if I sort of tie this back to, one of the pieces of our mission was about civic and professional responsibility. This is, again, another way that we help try to model those ideas to our students, being able to go somewhere that doesn't have the same services that we have here in the United States, and to help provide those services. In terms of outcomes of our program, there are three things actually that we're required to report based upon our accreditation. The first of these is our graduation rate, which simply outlines, out of all the students that we have enrolled into our program, what percentage of them ultimately graduate from Drexel. This is a 3-year average that we're required to report. So over the last 3 years, 96% of the students that have enrolled in our program have graduated from the program. The 4%, normally, if they do end up leaving, it may be for academic reasons. Sometimes it's for medical or personal reasons as well. The second thing that we're required to report is our employment rate, which just simply indicates the number of our graduates who are employed 6 months after they graduate, and that's 100%. All of our graduates have been employed within 6 months of their graduation. And then the last piece here is our licensure pass rate. This is something that we're very proud of here at Drexel. We have a 100% ultimate pass rate in the licensure exam. But perhaps the thing that we're most proud of is that 98% of our students pass it on the first try when they take it. So our students walk into this licensure exam prepared for a lot of different reasons, I think, and generally do really well that first time taking it. If you compare our average scores to national means and stuff, our students tend to do really, really well on this exam. In terms of cost, the total tuition for the program, so over the 3 years or so, is just over $106,000. Obviously, that's broken up per quarter. You're billed per quarter for those amounts. There's an awful lot of our students who do apply for the program, or who ultimately come to the program, apply for financial aid. That might come in the form of grants and loans. And then Drexel also provides a Dean's Merit Scholarship to a number of students. These merit scholarships are something that you don't have to apply for separately. Every student is evaluated for these. They range anywhere from 15,000. I'm sorry, we just changed it this year, so I'm stumbling over this a little bit. They range anywhere from $12,500 to $50,000 over the 3 years in the program. So for students who get that $50,000 scholarship, it ends up paying for a little under half of the overall cost of the program itself. Normally, somewhere about half to 60% of students end up qualifying for these merit scholarships. So there's just not one or two of them that are floating out there. A number of students get these, and they're obviously very helpful in terms of defraying the cost of the program itself. So I'm going to turn things over to Erin now, who will talk a little bit about the application process.
Okay, hi everyone. As Dr. Gard mentioned, I'm just going to spend a couple minutes talking a little bit about admissions and the application process. So we utilize a centralized application system called PTCAS. It actually opened on July 1st, so we are excited that we are entering another admission season. Anyone who applies this year would be starting, if accepted and decides to come to Drexel, would be starting in September of 2018. We are rolling admissions, so if there's any advice that we can give you, it's definitely to apply as early as possible. As soon as the applications are complete and the GPAs are verified by PTCAS, the admissions committee starts the review process. And you want to keep in mind that we do have an October 2nd deadline, which falls on a Monday this year. The other thing that I want to mention too is part of the admissions requirements is an interview. So if you are selected to come to an interview day on Drexel's campus, you would have an opportunity to come and listen to a detailed presentation on the program, as well as an opportunity to tour our facilities and also speak with our current students. So it's really a great time to experience all about Drexel. In terms of prerequisites, and specifically focusing on the science prerequisites, we do require a full year of biology, chemistry, and physics. They do need to contain a lab component as well. The other science that we require is either a year of the anatomy and physiology series, or two separate. You could have one course in gross anatomy with a lab, and then you could have a course in the human physiology with a lab as well. Speaking outside of the science prerequisites, we do have two additional prereqs, which is a psychology course, and then also introductory statistics. In order to satisfy the prerequisite requirement, we do require that you have obtained a C or higher in the course. And a lot of times, individuals will ask if a certain course will satisfy the prereq requirement. If you do have any questions about that, what we ask is that you email us a copy of the course description and the syllabus. And at the end of the presentation, I'll share that email where you'd want to send the information to directly. In terms of additional prerequisites for the program, the bachelor's degree is required, and the GPA requirement for that is both a cumulative GPA and a science GPA of 3.0 or higher. There is no supplemental application as well, I should mention, for PTCAS. But in addition, there is an essay question that's asked through PTCAS. Each year, the question can change, but you just want to keep in mind that that will be asked as you go through the process. Additionally, we require observation hours. We require at least 50 or more, and we really do like to see a variety of these experiences in the application. The hours must be verified by a licensed physical therapist, and through PTCAS, they really have two nice options available. You can either do an electronic verification for these hours, where the PT basically can just electronically sign off, or there's also an option where you can upload a signed form as well if that works easier for you. We also have the GRE as a requirement. Our minimum score is a 300 combined for verbal and quantitative, and then a 4.0 on the analytical section. A lot of times we'll get the question, you know, what if I have to retake the test multiple times? If that's the case, we do take the highest score from each section. It can happen on different test dates, so please keep that in mind as well. We also require 2 letters of recommendation. One needs to come from a science-based professor or an academic advisor, and the other needs to come from a physical therapist. One thing I just like to note is that PTCAS will allow you to submit up to 4 letters of recommendation. The committee does look at every application in its entirety and reads every letter of recommendation that comes through. So if there are other people that can speak on your behalf to your qualities and your assets and your dedication to the PT profession, I definitely recommend submitting more than 2 if that is something that you would like to do. And then lastly, again, the interview is required as part of the admissions process. We spent some time just talking a little bit about the program and the curriculum, but we just want to highlight a couple key takeaways from today's from today's webinar. And first and foremost is really that long history of PT education. So in the 35 plus years history of the program, we've definitely have been dedicated to developing excellent clinicians that are innovative and also, really embrace that evidence-based learning. We also have extremely passionate faculty that are invested in our students' success. A lot of times I'll hear from the students that the faculty truly view them as colleagues rather than just the faculty-student relationship, which I really think speaks volumes to the program and the relationships that are built during your time here. Also, we touched upon the technology-infused curriculum. Again, Drexel being that leader in innovation, and we're always looking for ways to include the technology integrated throughout the curriculum. Students have the opportunity to train with faculty. Again, this can occur in one of Drexel's 3 owned and operated sites, which is definitely a great opportunity to continue to get exposure to PT and begin learning all the skills that you're applying in the classroom. And then lastly, we have a healthcare-rich urban environment. Philadelphia truly, really is a great city. It is just well known for all different types of activities, but also one of the great benefits is the access that you have to different healthcare systems. There is an opportunity for exposure in all areas of PT in all different settings, and that's something that's really great in terms of the location here at Drexel. As I mentioned earlier, this is the website where you can obtain some more information. We tried to cover things that you couldn't really find on there. But at this time, we are going to turn it over for questions. It looks like we have plenty of time to do so. So at this time, if you could type in any questions that you have in the chat feature, Dr. Gard and myself can address them. It looks like we didn't get any throughout the presentation. So if you just want to take a couple minutes and think of anything, certainly feel free to do so. Okay, so it looks like for the first question, we got how many students are accepted each year. And I just want to touch on the size of the cohort with that question. So typically our cohort is about 55 to 60 students. And then that would be, for the current class that we're enrolling, so the 55 to 60 mark. You're welcome.
I just sort of throw a comment in relative to that. So as Erin said, we try and enroll 55 to 60 students or so. Those 55 to 60 students take a lot of their classes together, but there are points in our curriculum where we divide you guys out into even smaller groups. Good example of that is your lab sessions. We normally divide the group into half, and then we put normally a few more faculty members into those lab sessions because the content in those normally involves things that you need a little bit more help with. But then there's also some classes in our curriculum where we break up in even smaller groups into groups of like 10 or 12 because they're more of seminar type classes or problem-based learning type classes where there's a lot of interaction going on. So the cohort throughout the course of the curriculum, kind of gets divided in different ways depending upon what we think would be the best way of learning particular content.
It looks like we have another question. What are other prerequisites for international students? So there's a great list on the website in terms of additional prerequisites. The one definitely to touch upon is the TOEFL, the test of English exam. And in terms of scoring, that information is available on the website, so you definitely want to look at that. If you're reading through anything and you have more questions about the information that you're viewing, you can definitely email me directly and we can talk a little bit more about that in detail. And then we also have, if classes are retaken, do you average the 2 grades or take the higher grade? PTCAS actually takes the average of the 2 grades to verify your GPA.
So there's a question here too. It's a great question about, do students partner with students/professionals from other medical/health professional fields, i.e. surgeon, psychologist, psychiatrist, primary care physician, to talk about health cases from a variety of perspectives? So this really gets to a hot topic in all of health education now, which is interprofessional care. And at Drexel, we've actually done a lot of work in this area, and I can point to a number of different areas that our students get exposed to this. The largest of which is our clinical practice that is on our Center City campus is actually part of a multidisciplinary practice that involves 6 other disciplines as well as medicine, all from the College of Nursing and Health profession or our College of Medicine. So our students in that get exposure to healthcare from a number of other professions, including nutrition, couple and family therapy. We have a creative arts therapy program, as well as physicians. In addition, at our 11th Street clinic, the pro bono clinic that I mentioned before, that's the medical facility up there is a nurse practitioner run medical facility. So our students interact with the nurse practitioners in that environment. We are also in the college itself, we run quarterly what are referred to as case rounds, which can be interdisciplinary as well, where a particular case is presented. And we do this separately within our department, and then also we do some of them interprofessional. If it's an interprofessional case, then you may have students and faculty from the physician assistant program or from the nursing program or from the creative arts therapy program, all chiming in about how they would address certain impairments or certain aspects of this case to help this person ultimately get better. And then the last piece that I'll sort of throw in here too is the college actually has a multidisciplinary committee that is looking for further opportunities for interprofessional education, because CAPTE, our accrediting body, actually just included interprofessional experiences in their new credentialing criteria, as did some other credentialing bodies for some other disciplines. So this is becoming a very, very hot area, which it should be. So Drexel's doing a lot of work in this area. There's another question about how many classes are taken during a particular quarter. And that's a good question. To be honest with you, it varies a little bit. In straight didactic quarters, you might take, those would typically involve perhaps your first year here. You may be taking 5 or 6 classes during a particular quarter. There's other quarters where you might be on a clinical rotation where you might be taking 1 additional class while you're out on your rotation. A good example of this is when you do your first clinical rotation, you actually take a pharmacology course. And that course is offered online while you're out on your rotation for the exact purpose of trying to integrate what you are learning in the clinic or the health setting that you're in with what you're learning in pharmacology. So some of the assignments that you do in that course or some of the discussions that you have in that course involve some of the medications that you're seeing your patients take and how your interventions might impact upon those, or how you have to consider those medications when you're deciding what you do with the patient themselves. I'm trying to think too, there's at least 1 quarter where all you're doing is you're out on your full-time clinical rotation. So hopefully that sort of covers it and gives you an idea.
And if you'd like to see what the curriculum grid actually looks like, if you, again, go to the website, Next to the admissions tab, there is a tab that's called curriculum, and I believe it's the second or third bullet point down, but you can actually download the PDF. And it does a really nice job of laying everything out for you quarter by quarter and year by year. If you have any problems finding that, you can also email me as well, and I'll be happy to send it to you. Looks like we also have a question about what are the other additional fees in addition to tuition? So in terms of additional fees, there is a one-time standardized patient lab fee that's assessed only during your first quarter. I believe it's $260 that first quarter, and again, that's the only time that you're assessed that. In terms of other fees, every quarter you're then assessed a program fee of $205 per quarter. In addition to, as a full-time graduate student, there's a $280 fee assessed per quarter.
So I'll just sort of touch on too what some of those fees cover, because sometimes I know as a student you get charged all these fees and you kind of wonder what they're going to. Some of those fees go to things like the cadavers that we provide to you guys in your anatomy course. So during your first 2 quarters here, you'll dissect a cadaver with a group of about 5 students or so. Some of your student fees go to help defray that cost. There's also costs related to clinical education and some of the software that we use to facilitate those placements. That helps defray some of that cost. There's equipment that we use in labs and that sort of thing that your student fees help defray some of those costs. For the university fees and stuff, things like the rec center, which is the gym that's on Drexel's campus, as part of those fees, you get access to that. That's actually where our physical therapy practice is, and it's a place where a number of our students go to work out, lift weights, do cardiovascular work, participate in intramural sports, use the gym to shoot baskets, those types of things.
Okay, so it looks like the next question is in regards to retaking classes. If the class is being retaken during the application process, how will the first course's grade be factored into the application decision, knowing that the grade may improve? In terms of, again, retaking the classes, PTCAS is going to look at that transcript and utilize that first grade that you received into verifying the GPA. My recommendation would be to actually send an email to let us know that you are retaking the course so that we can kind of monitor that and then also make note of it when reviewing the application. You can send that email to the email listed on the slide that you can see, but again, it's ptadmissions@drexel.edu. And then specific to Drexel, what can a potential applicant do in order to stand out amongst others? That's a really good question. I think that personally, there's definitely a couple things you can do. One is just know that we do look at every application in its entirety. And I like to highlight that we do put a lot of emphasis on the letters of recommendations. So again, I would really encourage you to think about who you're asking to write those letters. It definitely helps us get a really good sense of the applicant if we can understand, specific traits and things you demonstrate, such as compassion and being an active learner and your dedication to learning physical therapy. I would also say if there's anywhere in the application that you can really highlight, those extracurricular opportunities that you've done, or any study abroad experience, make sure that's captured in the application. Also, the observation hours, a couple things with that is it's always nice to see a variety of settings or hours completed. It kind of shows us that you have been exposed to various areas of PT and really have a breadth of exposure to that.
The other thing I would sort of add to that is Erin mentioned before that we interview all the people that we feel are competitive to enter our program. And we do that because we really want to get to know you as more than just uh, numbers, grades that you might have, or GRE scores that you might have, or the essay that you wrote. Interviewing you really gives us a feel for who you are, as well as gives you the opportunity to meet faculty, see our facilities, and get an idea of who we are, so that we can really figure out if this is a good match between the two of us. It's, for this to really work well, it's got to be a good match on both ends. So, as you can imagine, interviewing all those applicants is a huge time commitment to try and do that. It'd be much easier for us to just sort a spreadsheet of GPAs and GREs and make our decision that way, but that's not really the way that we want to fill our class. So those interviews, I think, are a great way to really get you to stand out and for us to really get to know who you are and to determine if, again, it's a really good fit from both perspectives. So there's a question here too about what are the policies around clinical rotations? Are there particular locations or fields to choose from? And how are those decisions typically made? This is a really good question, and one that seems to evolve every month or so because the clinical education environment is just changing so rapidly. Drexel's philosophy around clinical education is that we want to see you do rotations in a variety of different areas. I'll use this example because I'm an orthopedist. When I came into physical therapy school, I would have been perfectly happy doing all my rotations in orthopedics. Fortunately, I was not allowed to do that, and I had to go experience physical therapy in a number of different settings, which is important because, again, when you take the licensure exam, you're going to be tested on a number of different areas, and it's important that you get exposure to those particular areas, because although you might not think you're going to work in an acute care hospital and you're just going to work in orthopedics, the reality is a lot of the patients that you're seeing in that outpatient orthopedic clinic came through the acute care hospital, and it's good for you to know what they experienced there, and what the physical therapy might have been like at that particular setting, those types of things. So we want you to do a variety. Want you to do your rotations in a variety of different settings. Generally, a lot of clinical education has turned into what they refer to as a first come, first serve system. So essentially what that means is that about April 1st or so is the national date when all programs send out their requests to facilities across the country. Which essentially means, we at that point we send out the dates for when our students are going to be available for clinical rotations. Facilities that are willing to take a Drexel student or willing to take a student from a number of different schools will normally respond to those schools and say, we have a first come, first serve opportunity available. Whoever responds to us first gets this. So what we've done in response to that, instead of what used to happen is a lot of facilities would come back to us and say, hey, we'll take a Drexel student, and then we'd be able to present to our students a list of 100 different options or so that they might have. Instead, what we end up doing is we send those out to our students and ask students if they are interested in these. And students have to respond, honestly, quickly to those, and then we'll respond back to the facility and try and match students to those places. Now, that being said, that whole process is done with a fair amount of guidance from our faculty as well. We have 2 faculty members here that run our clinical education program, and they do a lot of work to try and make sure that the facility that you're going to go to is a good match for you, both in terms of just geographic placement, the pace of the particular place, the patients that they see, is it an area that you might be interested in, and that sort of thing. So the one thing about our program is by the time our students graduate, one of the things that I hear the most compliments about are the quality of rotations that we have and, the experience that our students had in the rotations that they went to. So there's also a question here about for DPT students considering a PhD for research, Is your program a transitional PhD program or a separate program requiring another application process? So actually, Erin might know a little bit more about this than I do. This is an interesting question, and it's one that's becoming more and more popular. We've actually had discussions about this exact topic because we've had some DPT students who have come through who have expressed an interest in this, and honestly, from a faculty perspective, we thought a number of those students would be great PhD candidates. So we've actually not fully decided anything on this yet, but we are entertaining the idea of doing this. And the current thought would be is that some of the coursework that you would take in the regular DPT program might be a little bit different. And the best example of that is maybe some of the research courses that you took that all of our students take in the DPT program. A particular student who might be interested in a PhD program might take a little bit different research course because obviously the requirements in a PhD program relative to research is a little bit different than for a DPT student. But then the credits for those would transition or transfer into their PhD program. And then, what other additional coursework and things that they'd have to do to satisfy the requirements for the PhD, they could pursue those. And again, I think it would be, we don't really know at this point, but at this point, I wouldn't really see it as being a separate application process. There'd certainly be some sort of process around that, but I'm not certain exactly what that would be.
I'll just add two things regarding what Dr. Garg said. So in terms of the PhD, first and foremost, if students are interested and they let myself know, currently right now what we're doing is we're letting the PhD program director know, and she's actually setting up meetings with these students to talk a little bit more about the PhD program and potentially things that may be in the works or what that looks like once it's finalized. And then in terms of application, those discussions that are happening is there might be like a separate essay or writing component in terms of it, but not necessarily a full application since Drexel would already have your existing materials on file. So hopefully that helps a little bit with some additional information for you. Okay, so I think we are finished with the questions. I just want to thank everyone again for taking time out of your afternoon to learn a little bit more about the Drexel DPT program. We hope you found it beneficial, and certainly I encourage you to look at the website and also reach out to us directly with additional questions. And thank you very much again.
Yeah, good luck in your application process.
Take care.